It looks like we have more people joining us as we start this presentation. This is one of many presentations we've started since January because of COVID. We've figured out different ways to reach out to people, and Dr. Kellman has been kind enough to be our presenter tonight. Dr. Kellman is a functional doctor and internist. He's the medical director at the Kellman Wellness Center in Manhattan. He is the founder of Microbiome Medicine, the author of 12 books, the host of a weekly radio show, MD Holistic Healing, as well as many other things. I've known Dr. Kellman personally for over a decade, and the things that he has done 10 years ago, now traditional corporate doctors are starting to accept as normal. So Dr. Kellman is the guy that everyone goes to when they failed with all their other doctors and they find Dr. Kellman because he gets all the difficult cases. So brilliant guy. I have the pleasure, like I said, I've had the pleasure of working with him for many years, learned a ton from him, and we feel very fortunate to have him here tonight. So my name is Phil. I am one of the pharmacists here at Healthy Choice Compounding Pharmacy. Corinne? What we are, we've been compounding since 1997. About 5 years ago, we moved to a state-of-the-art USP 800 compounding facility. And what that means is that all we do is compounding. And we're all about personalized medicine. We've always been about dedicated to what we do. That's why we moved from a traditional retail into compounding, because compounding has been our passion. We love to provide cutting edge information, and that's why Dr. Kellman's here tonight. We hear about education, and we're about creating personalized medicine. Just the other day, we had to come up with for a child, a lithium gummy bear that we made into a chocolate candy. So it's really about creating and using our knowledge to help people. Some of the ways that we do our things is through bioidentical hormones, men's and women's health. Dr. Kellman's been really active in that, andropause, menopause. He is a leader in thyroid hormone replacement for us. We must make over 1,000 different forms of T3, T4 that Dr. Kellman creates for his patients. So it's really a personalized approach for his patients. Low dose naltrexone for those patients with autoimmune issues is huge, and it's going to become bigger as we move forward, as over 25% of the population has some sort of autoimmune issues. Pain management, ketamine, topical pain, dermatology, really finding the right medications for these patients. And we do this by making creams, capsules, suppositories, really figuring out what each patient needs to enhance their therapy. This is our facility. This is where we work. This is where we create our magic. You can always contact us at our website, through our phone. You can text us to that phone number as well. And I don't want to take much more time because I'm going to turn it over to Dr. Kellman, who has a lot more information than I have. Dr. Kellman, take it away.
Well, thank you, Phil. First of all, I want to thank you for having me on. And I also want to thank you for working together, and we have a great collaboration, and thank you for that. And I think it really helps patients tremendously.
Well, thank you.
All right.
All right, Corinne, you ready?
Yep.
And FYI, Corinne is my inside marketing person. She's the person a lot of people speak to, and she'll be handling all the slides tonight.
Okay.
Yep.
So I'm going to be speaking about hidden undiagnosed thyroid disease. So many people, more women than men, but men also could have thyroid disease, absolutely. But so many people have undiagnosed thyroid disease. They're living their lives in a much more than a suboptimal way, and with fatigue and weight gain and other symptoms. But the diagnosis is not there. Okay, so we're going to the next slide. Okay, so this is a little bit about me. Phil already said that, so let's go to the next slide. I'm the medical advisor to Solar Array, and we make a number of different microbiome supplements. Okay, so this we've already discussed. These are, I specialize in a wide variety of issues, a lot of complex, undiagnosed problems especially with fatigue, unexplained metabolic problems and headaches and gastrointestinal disorders, weight problems, difficulty losing weight, weight gain. I also deal a lot with patients with Lyme disease, autoimmune diseases, a wide variety of autoimmune diseases, and our specialty is getting to the root cause of reversing autoimmune diseases. I deal with neurodegenerative diseases. I deal a lot with cancer patients, especially after they finish chemo and dealing with all the residual symptoms that they have. Okay, let's go to the next slide. All right. So a little bit about the thyroid. It's here in the neck. It produces a number of hormones. The main ones are what we call T4 and T3. The more active one is T3, but T4 is also active. It's basically the of every cell in the body. So if you don't have gasoline, it could affect the brain, it could affect the liver, it could affect the muscle, it could affect the gut, and you could have 100 different symptoms: fatigue, weight gain, constipation, gut issues, cognitive dysfunction, poor memory, brain fog, and weight gain, difficulty losing weight. And some people just have one or two of the symptoms, but frequently it's more than that. And these are just some of the symptoms, and also many other diseases. The root cause could be hypothyroidism. So, for example, cholesterol issues, even reflux, immune dysfunction. Invariably, when you have one autoimmune disease, you tend to have hypothyroidism as well. Cardiovascular disease, low thyroid is a prominent risk factor for cardiovascular disease and with dementia as well. Okay, let's go to the next slide. Okay, you have hypothyroidism. Hashimoto's is one cause. There are other causes. I've identified a condition called NTIS. By the way, there's also Graves' disease, fast thyroid, but we're going to focus more on underactive thyroid. But a significant percentage of people with complaints of fatigue, chronic health issues, depression, brain fog, gut issues, etc., poor memory, they have, and especially when it's chronic with these symptoms, there's a condition called non-thyroidal illness syndrome. This is something that I'm bringing to the forefront. I have a book coming out in the fall that speaks a lot about NTIS, and I really believe that it's the #1 cause of hypothyroidism. It's missed completely because the blood test results could be very deceiving. And I have to say, even holistic and functional medicine doctors miss this because the reference range is totally different. And it's a very big issue. So if you're complaining of chronic health issues, the chances that you have NTIS are very high. If someone has protracted depression, protracted stress and anxiety, protracted gut issues, a long history of any chronic health issue, the chances of NTIS is sky high. Okay, we'll go to the next slide. Now, 20 million Americans are diagnosed with low thyroid, but many more people have low thyroid and they don't know about it. And that number is much higher. And it is skyrocketing hypothyroidism, not only due to the fact that there's so much chronic disease, but because as the toxic environment build up, so does low thyroid and hyperthyroidism as well. Additionally, autoimmune diseases is on the rise as well, and Hashimoto's is a prominent cause of hypothyroidism. Thyroid disease is an epidemic. Okay. Now, the problem with low thyroid is that many of the symptoms can be caused by a wide variety of issues. But here's the really big problem. Most doctors dismiss the issues as everything's fine. Mrs. Jones, your blood tests are totally normal. Everything's fine. You're fine. But then people leave, Mrs. Jones leaves the doctor's office very perplexed because she or he does not feel fine. Okay, we'll go to the next slide. Uh, these are some of the symptoms: weight gain, fatigue, muscle and joint pain, feeling, a big symptom is, I feel like I'm aging. I hear that all the time. Cold feet, constipation, but sometimes irritable bowel syndrome, reflux. If you have reflux, the chances that you have hypothyroidism is pretty high. And here's the list. It can range from A to Z, but take the list down and you'll see that this accounts for so many people's symptoms. It's just unbelievable. And again, by the way, you don't have to be overweight to have a low thyroid. If you have gut issues, uh, you could actually be thin and have a low thyroid. But most of the patients are difficulty lose weight and have weight gain. By the way, difficulty sleeping. People are so tired with hypothyroidism, and yet they could have insomnia as well. It sounds paradoxical, but it's not. And here I mentioned trouble sleeping, irregular heart rate. Hypothyroidism is a prominent cause of an irregular heart rate. Now, why is that so? Because you're more likely to produce free radicals. These are unstable molecules that antioxidants quench and neutralize. But when you have an underactive thyroid, the research shows that you're producing many, many more free radicals. You're more susceptible to inflammation. And that is a root cause of palpitations and an irregular heartbeat. An irregular heartbeat and arrhythmia, the cause is not due to the fact that you're deficient in an anti-arrhythmic drug. I'm being a little facetious, but the truth is that the reflex response to an irregular heart rate by cardiologists is two. One, everything is fine, don't worry about it. Two is, here's a medication as an anti-arrhythmic drug, but it's not getting to the root cause. And a frequent and a common root cause is hypothyroidism. Okay. Now, hyperthyroidism, a fast thyroid, palpitations is a common problem. And, you would think that there's no weight gain because it's fast, but you can have weight gain too, frequently weight loss. And here's something that most people don't realize is that, and doctors don't realize, is that sometimes you can have a mixture of hyper and hypothyroidism, and then the symptoms are totally elusive. All right, we'll go to the next slide. Now, why do people get hypothyroidism? So number one, as I mentioned, I think non-thyroidal illness syndrome is the number one cause, and it will raise the incidence of hypothyroidism significantly. Now, Hashimoto's is a common cause as well. I tend to think it's either number two or number three. Endocrine disruptors, chemicals in the environment, they're called endocrine disruptors. They're so prominent in our environment, and it's getting worse. It's another frequent cause of hypothyroidism, and that's a lecture in itself. But endocrine disruptors is something everyone should know about. It's wreaking havoc on our health. Okay, let's go to the next slide. Now, NTIS, it was originally identified in patients in the ICU. Now, that's a serious health issue. And if you're in the ICU, obviously, and they found that many of the patients have an underactive thyroid. But the problem is coming from not the thyroid, but from the hypothalamus and the pituitary. These are glands in the brain that send messages to the thyroid. And what they were finding is that the signals were depressed. And the blood tests were extremely elusive. If you folks know a little bit about the reference range, usually when your thyroid is low, the pituitary senses it and it starts producing more TSH in an attempt to wake up the thyroid, an attempt, because it usually doesn't accomplish it. So you would expect to have high TSH and either normal or low T4, T3, but could be normal. That's, very, makes the blood testing very elusive. But when you have NTIS, instead of having high TSH, it's actually depressed. Okay, let's go to the next slide, please. Okay, so the problem with, in conventional medicine, but I don't want to, blame conventional medicine. I look at it is that there's frontier medicine and there's less frontier medicine. Let's put it that way. Uh, in order to treat and help a wide range of people, and I'm talking millions of people who are falling through the cracks, who are being told that you're overweight because you're eating too much, that you're depressed, here's an antidepressant, you're tired because you're getting older. All those excuses are nonsense. And this is the patient population that, I'm here to help because I've identified it. And why I've identified it is because of the test that I use called the TRH stimulation test, which I'll maybe touch upon tonight. But because I use that test, I was able to identify this epidemic, and without doing that test, you're not going to pick up this significant problem. And so many people out there fall in that category, and I call it, they're falling through the cracks of modern medicine. And the abnormalities in the microbiome, those are the trillions of gut bacteria. I've written a few books on that, is another very important cause of uh, hypothyroidism for many reasons, because the bacteria modulate the immune system, and you can get autoimmune Hashimoto's when your microbiome is unhealthy, but also you can just get inflammation. Inflammation is another common cause of low thyroid. You can put that in the category of autoimmune, but it's not autoimmune. We're not putting up markers that define it as disease, but still inflammation is causing it. And that's also connected to endocrine disruptors, because endocrine disruptors cause inflammation as well. Adverse childhood experiences is a major cause for autoimmune disorders. And this is a topic in itself. And, who did not suffer from adverse childhood experiences? Some much worse than others. The chances that you have an autoimmune disorder skyrocket. So any presentation about Hashimoto's cannot leave out adverse childhood experiences. All right, let's go to the next slide. Diagnosing thyroid disease is very tricky. Uh, the blood reference ranges you can't rely on for a number of reasons. One is that the reference range is too large or too small, because they pool, when they come up with these reference ranges, they're pooling thousands of people. Many people feel that they were using reference ranges that could, dead people could fall in those. Maybe they pooled dead people. I mean, people with significant disease. But there are many people that have low, not, the range is not as large, but they have hypothyroidism as well. They missed many people with symptoms of low thyroid, but also there's a personalized reference range that is different from one person to the other. That's called precision medicine or personalized medicine. And another reason is that these blood levels of thyroid hormone and pituitary hormone could fluctuate, vacillate in any given day by 40%. And especially when the thyroid has been low for a long period of time, the numbers could be all over the place. All right, so let's go to the next. And by the way, that's a conversation in itself. I don't want to prolong it, but we'll take questions in a few minutes. These are just some of the blood tests. You must get all of these antibodies, reverse T3, total T3, total T4. And the TRH stimulation test is that's what I do. Now, they used to use the test. Doctors erroneously believe back then in 1997, 1998, or that, oh, we don't need that test anymore. Now, why they came up with that conclusion is another subject, but I resurrected the test and I said, no, we need this test because I was seeing patients. I started doing holistic medicine many years ago, and most people weren't doing it. Many people who came to me in those days just had chronic health issues and they weren't getting better. Regular doctors weren't helping them. They heard about me. I was helping some people in this category, and they weren't even interested in holistic medicine, but they wanted to go to a doctor who listened, who were helping people who were falling through the cracks. And that's when I said to myself, look, all these people have so many symptoms of low thyroid. Something wrong is here. It's not that the people are crazy, and many people have dismissed as crazy, but there's something wrong with the reference ranges and routine tests. And that's why I resurrected the TRH stimulation test. Subsequently, in 2007, at least 2 studies came to the same conclusion that for many people that fall through the cracks, that you do need the TRH stimulation test. And that's what I do. Now, let's go to the next slide. Okay, so that's about the TRH stimulation test. And this one test has changed tens of thousands of lives. Okay, let's go to the next slide. Well, good, we're wrapping it up. That's my phone number, 212-717-1118. Our website is kellmancenter.com. Again, the number is 212-717-1118. We do telemedicine. We do it. A lot of technology. I use a lot of technology to stimulate our body's capacity to heal. I believe in the 3 A's. We want to augment, we want to activate, and we want to accelerate the body's ability to heal. And I have a lot of technology that I use to do that. And thank you for listening. And Phil, thank you so much. I really appreciate listening. Some phone calls or email questions, okay?
Yep. So we have a bunch of questions, and if you guys have any questions, feel free to either raise your hand or write it in the Q&A. First question, do you have any knowledge about the use of thyroidinum?
I'm sorry, thyroid what?
Thyroidinum, I-N-U-M.
I-N-U-M?
Yeah, thyroid, I-N-U-M.
Is that a supplement? Is that a particular holistic supplement? Is whoever asked that question? Because it must be some supplement that some company makes, and it probably has iodine in there. It may have selenium. It may have iron. It may have tyrosine. It may have ashwagandha. All of these herbs and minerals play a role in the production of thyroid hormone and in the conversion of one T4 to T3. Let's go to the next question.
Been on compound meds for Hashimoto successfully for many years. Are there natural remedies that are better?
Well, some people you could treat with iodine. Not if you have Hashimoto's. Some people, there are natural compounds that absolutely could help. When someone has non-thyroidal illness syndrome, these supplements need thyroid hormone. When you have chronic thyroid issues, you need bioidentical thyroid hormone. I get it from Healthy Choice. So most people will benefit the most with using bioidentical natural thyroid hormone. Okay, let's go to the next question. Marcia.
Sure. Autoimmune versus allergies. Can allergies have the same effect of an autoimmune reaction like gluten, peanut, or dairy allergies?
Well, when you have allergies, that could be a root cause of Hashimoto's, absolutely, or it could just be augmenting the problem. One of the causes, and the number of causes of Hashimoto's, toxins, microbiome issues, stress, adverse childhood experiences, nutrient deficiencies, and the list goes on and on. Allergies is certainly one of the contributing factors, especially to gluten. Okay, let's go to the next question.
How prevalent is congenital hypothyroid, and is it curable?
Congenital hypothyroidism is absolutely these children need thyroid hormone. That's the best way to go. Absolutely. All right, let's go to the next question.
Good question. Yep. When should a thyroid pill be taken? Should a thyroid pill be taken in the morning if I have a thyroid blood test that day?
It's a good question. You have to allow for at least 3 hours before you do the blood test. It's generally better not to take it the day of the blood test.
Great. Can Hashimoto's be reversed?
Absolutely could be reversed. I do this day in and day out. And if you must attempt to reverse it. Just taking thyroid hormone and saying, well, your Hashimoto's, there's nothing you could do about those antibodies is medically and scientifically erroneous. There's plenty of things to do. And as medical doctors, we're obligated to get to the root cause of Hashimoto's, and we definitely can normalize those antibodies. And with all I mean, I see crippling autoimmune diseases, including scleroderma, which is virtually a death sentence, and we reverse it without significant medications. Frequently, they get off their medications. So Hashimoto's can be reversed. That doesn't mean that every single one patient can get off thyroid hormone. Many can, some can't. But the root cause can be reversed, and it should be reversed. And that's one of my specialties.
Great. Should iodine be taken as part of a supplement regimen?
Okay, that's a tricky issue. If you have Hashimoto's, you definitely should not take iodine. It will make things worse because it will propagate inflammation. Okay, it's a big mistake to take iodine if you have Hashimoto's.
Dr. Kellman, it's actually funny. I have Hashimoto's, and I take a multivitamin, and there's iodine in the multivitamin. I couldn't find one without it. So.
Well, there you go. You're not alone.
Yeah.
Iodine should not be used.
Gotcha.
By the way,
next.
Shakes and smoothies with kelp is a problem as well.
Really?
Yeah.
Oh, I'll write that one down. Very interesting.
Yeah.
All right, next question. What is your take on naturally desiccated thyroid?
I think it's great. I use it a lot. Frequently, I'll combine it with T4 or T3. One of the problems with nature thyroid or almond thyroid is that the ratio of T4 to T3 is a little bit off. There's too much T3 in relationship to the T4. So sometimes what I'll do is I'll use Armor or Nature Thyroid, whatever I get from Phil, and I will add a little bit of T4 to balance it out. By the way, that's the beauty of compounding medicine. You could tailor it to what people need, and you overcome so many problems with just giving Synthroid or even just giving Armor. You got to be precise, and that's the beauty of using a compounding pharmacist, like Healthy Choice.
Thanks for the plug.
Yeah, Why not?
Why not?
This is a great question, I think. Also, adrenal fatigue. How to differentiate between thyroid issues and how to treat adrenal problem. Many thanks. That's
a good question. Absolutely, it's a good question. Many of the symptoms overlap, but there are certain words that people use that almost diagnose hypothyroidism. And by the way, Lyme disease too. I feel like I'm dying. That's Lyme disease. I've had cold hands, cold feet for such a long period of time. you know, my brain doesn't work. I mean, there's some, I feel more tired when I wake up than when I went to sleep. When you hear phrases like that, you know, think hypothyroidism, and not necessarily adrenal issues. Adrenal issues have different phrases associated with it and complaints. So there's some overlap, but there's a lot of factors that distinguish the two. But, you know, invariably, the two do go together, and you can't treat one hypothyroidism without treating adrenal dysfunction as well. And both should be treated concomitantly. So let's go to the next question. These are good questions.
They're all really good questions. Can thyroid affect your circulation? Is there a good diet for people with thyroid issues?
Okay, so that's two questions. Okay. Phil,
Put that one in.
got a lot of smart people here. You know, look, you know, hypothyroidism could cause Raynaud's. You can definitely get significant vascular issues, absolutely, and cardiovascular disease as well. So it can cause Raynaud's and, you know, cold hands, significant cold hands and feet. The diet for hypothyroidism, you have to wait until my book comes out in the fall.
Well, give them a little taste. Let them give them something so they buy the book.
Well, if you have Hashimoto's, it's one diet. You want to be careful not eating too many foods with a lot of iodine. When you have hypothyroidism, you can have iodine. You know, I wrote books on the microbiome diet, so I'm biased to the microbiome diet. If you and you can read about it. You know, I wrote a book called The Microbiome Diet. A few others on the microbiome. And the microbiome diet is a very good diet for a wide variety of health issues. That's a lecture in itself, and we certainly could talk about that someday. Thank you.
Another great question. How has the pandemic influenced thyroid function, like lack of exercise, etc.? Because it seems my thyroid has plummeted.
Oh, I've been saying this, you know, I talk about this on my radio show all the time. It's one of the residual effects of the epidemic, the pandemic. There are a number of reasons why. Stress makes everything worse. It makes hypothyroidism worse. It makes autoimmune diseases worse. One of the reasons is that we need to be interacting with people in order to keep our microbiome healthy. We need to exchange bacteria. One of the causes between each other, one of the causes of autoimmune disease is this concept of that you need to be connecting to other people. The hygiene hypothesis is when there's too hygienic can cause autoimmune diseases. You don't find autoimmune diseases in Africa, or it's significantly less.
All right.
Interact with other people without.
So
Go ahead.
Next question. You said the thyroid level can fluctuate 40% at any given time. So how do you determine the compounding formula?
Well, that's the beauty of doing the TRH stimulation test. And I really believe that's what distinguishes my ability to be more precise with the treatment. There's so many people that are on thyroid hormone, but they still don't feel well. And you know, they just feel, well, I got to live with it. No, you don't have to live with it. You can have great energy. Many of my patients said, I feel better now in my 50s than I felt when I was in my 20s. So with the appropriate testing and listening to the patients, you also have to go by clinical symptoms even more times than what you get on the blood tests. So when you combine all these variables, you can be very precise in the treatment and the amount of T4 and T3 that you're going to prescribe. And that's the beauty of compounding hormones. I can't stress this enough.
Great. Okay. Next question. What do you recommend we tell a primary doctor when they ask why we are taking thyroid medicine when our blood test TSH is normal?
Well, it's going to be normal if you're taking thyroid hormone. Of course, it normalizes it. You know, some doctors will say, well, you don't need your thyroid hormone anymore because your numbers are normal. Well, of course, they're going to be normal when you're on thyroid hormone.
And some questions that people had submitted earlier, is hormone replacement therapy bad for Hashimoto's?
No, you do need it frequently, unless you're catching it really early. It's a fire. Autoimmune disease, Hashimoto's, look at it as like a fire that's burning down your thyroid. If it's been going on a long time, you're just not producing enough thyroid hormone, and you're going to need compounded thyroid hormone. But still, you have to get to the root cause and reverse Hashimoto's.
Gotcha. And regarding your TRH stimulation test, what exactly is it? Are you the only one who does it? Can you receive it locally, and does insurance pay for it? Loaded.
No, you can't. You can't do it locally. The only doctors who know how to do it in the tri-state area for sure are those that I trained, that I taught about it. Maybe there's 3 or 4 others. It fell out of vogue, so people, doctors just don't even know, either don't know about it or have this erroneous notion, we don't need that test anymore. It's just not true. I mean, you know, if you're at the frontier, you're going to use all testing to help make the diagnosis. And I did this by trial and error, and I resurrected it. And then I saw with my own eyes that this is an important test. So any doctor that says, no, you don't need it, well, you haven't used it, so no. And then I could show studies that agree with me.
Okay. We also have some attendees with their hands up, so I'm going to give them an opportunity to talk. That's okay with you, Dr. Kellman?
Yeah.
All right. We've got Janice.
Hello.
Hi.
Hi. I was wanting to know about the TRH test. I live in New Zealand and I don't know if it's actually available, but something I read is that it's not a good idea if you have atrial fibrillation or heart irregularity. They're not keen on doing a TRH test anyway. Can you respond to that?
Well, who is this doctor who knows about the TRH test? Because there are some, doctors across the globe that I've heard do use it. From my experience, that using the TRH test is not contraindicated at all if you have an irregular rhythm. I do it all the time.
Okay, thank you.
Sure.
Right, and then we can go to next attendee, Marcia.
Hi there. I had a question about, I am taking an estradiol gel every evening and 100 milligram capsule of progesterone. And I'm now 70. I've been taking this for over 15 years. I feel well. I think I'd like to stop taking it. And I saw actually a gynecologist today who told me I should just take it every other day and see how I feel. And then maybe we can lower it, but it's not from a compounding pharmacy. It's not, the estradiol is not bioidentical. So.
It must be bioidentical.
Yeah, it is a bioidentical.
Oh, but it comes in a can from England.
Oh, in any event, I'll tell you my experience. We have patients in their 60s, 70s, 80s, 90s, and over 100 who use these type of bioidentical hormones. And the key with the hormones is that you're maintaining or restoring your hormone function. Once you take that away, the benefits go away. So it depends on the quality of life that you want to have next 5, 10, 15, 20, 30 years moving forward. Physically, mentally, sexually, how do you want to view your life?
Well,
No,
I feel very well, and I'm just wondering if, I guess you're saying, don't stop, right?
Right, get your levels checked, make sure you're in level, everything is good, and then
All right,
continue.
so
That's my
here's the
opinion.
thing. I live now in Boca Raton, Florida, and I'm just wondering, is there a doctor that you can recommend in my area? Because the gynecologist I went to today, she said, oh, I'll do this test. I said, I want you to do all the tests. And she looked at me like I was crazy.
well, you could do telemedicine. I mean, I have patients all over the world nowadays, especially now. Telemedicine, the doctor doesn't have to be in your neighborhood. There is a lot of functional medicine doctors, including myself, who prescribe bioidentical hormone. Phil knows the whole list. So it doesn't matter where the doctor is from. You can get in touch with many functional medicine doctors who know how to use estrogen and progesterone correctly.
Can I change the subject a bit?
Sure.
So I was concerned. I wanted her to do some tests on my thyroid for no reason other than I just want to know I'm okay or not. Is it possible for you to give me a prescription and I have the test somewhere here and they send
Absolutely.
you? Yes?
Absolutely. I do this all the time. Absolutely.
Okay. I want to do it. I want to do it with you.
Take advantage of his 10-minute consultation.
Okay.
10-minute consultation too. Absolutely, I could help you with that. I could send you a script. We do that all the time.
Okay, perfect. We're going to do that. All right. Thank you so much. I'll fill out the form.
Thank you.
Or do I just call?
Call the office and they'll schedule it for you.
Great. Thank you so much.
You're so welcome.
Great. All right. Next we have Sherry.
Yes, I take Armor. It says to take it a half hour or hour before you eat. And I read somewhere that you should eat like an hour or so after you take it. Is that true?
Yes, that's true. Exactly. That's exactly right.
Okay, thank you.
Sure. Thanks for calling.
Great. We have Gail.
Hi, Gail.
Oh, I think Gail's still muted.
Hi, sorry, I didn't know I raised my hand. I sent my stuff through Q&A, but I'll ask you anyway. I have two questions. One, do the conventional labs like Quest do all of this extensive testing or just the normal top 4?
Well, then obviously the TRH test has to be done by a doctor. Absolutely. If the doctor checks off the right tests, they'll do it. Absolutely. It should be TSH, total T4, total T3, free T4, free T3, anti-TPO antibodies, anti-thyroglobulin antibodies, reverse T3, and other tests as well. But that's the basics,
Okay, great. And the other thing is, do you know if Medicare is willing to pay for any of this stuff?
Well, all the routine blood tests, absolutely. Not the TRH test, but you know that there are some insurance companies that reimburse for the TRH test because this test is a valid test. No one uses it, very few people use it, but it's medically acceptable.
Thank you.
Sure.
Great. And now we have Maria.
Hi, Maria.
No, Maria.
Give her a bit to get on. Oh,
Okay, can you hear me now?
Yeah.
And you hear me now. Hi, I'm just enjoying this so much and learning so much. I have a question. I have this thing that goes on where when I feel my best, and I do get that whole panel of testing, by the way, so I was so happy to see that my endocrinologist does the right things and does the whole panel. When all of those numbers are normal, my TSH is 0.02. It's super suppressed, but that's when I feel best.
Yeah.
Nobody else, when I go to other doctors, I'm so fortunate that this doctor is willing to listen to my symptoms, because that 0.02 scares every other doctor. They tell me my heart's my heart's going to suffer from that. I can't, some of them wouldn't even dose me at a 0.02 TSH. Is that something that's common, to have such a suppressed TSH when all
Well, let me put it this way, certainly not uncommon, especially if you have NTIS. Now, a lot of people have a combination of regular hypothyroidism plus a touch of NTIS. And those patients will absolutely have a TSH, could have a TSH of 0.02, 0.03, 0.9, et cetera. So the answer is absolutely that could be totally correct for you. And a very simple answer is that, you have to personalize reference ranges. What's right for you is not necessarily right for someone else.
Yeah, I mean, it's just hard because all the stuff out there is telling me that it's dangerous for me. So it's good to hear. I'm encouraged to hear that. I did have Hashimoto's. I don't have Hashimoto's anymore because I reversed it. So that's a good thing. My other question is a little more unconventional, and if it's not the right forum, I intend to call you up and make an appointment. So if this is not the right time, that's fine. But I have extremely bad, for years and years, SIBO.
Right.
I'm sure is connected to my thyroid.
Yes.
I have tried every diet, you can't even imagine, 8 years of trying everything, and it works for a while and then comes back. I'm wondering right now, and I was on the phone with Phil earlier today, if I should try, what was it? Low dose LDN, right?
Yeah, look, your Hashimoto's, the numbers may be normal, but it also depends on when you do the blood testing. There could be a touch of autoimmunity. An LDN would be beneficial. LDN is beneficial for so many health issues, all kinds of gut issues. I think LDN is amazing. So that is a definite an option for you. It can help, leaky gut. It can help SIBO. And also, it's likely that you would not put on the right herbs. And that's SIBO could be cured. It shouldn't be a protracted problem.
Oh, it's been forever. All right, so I'll call your office and I'm going to definitely make an appointment, but thank you very much.
You're very welcome.
Great. And then we have Lisa.
Hi, doctor. Thank you so much for having this. This is really informative. I did have 2 questions I wanted to ask you. I currently have a doctor who has done all the tests that you have suggested. I think all of them, most of them anyway, the TRH for sure. And I feel good, but I don't feel great. So I am kind of looking to change my doctors. One thing is he does take all my insurance. So I'm just wondering if you do take insurance, or is that something I have to deal with?
If you have out-of-network benefits, then, you'll be reimbursed. All the labs are covered. The TRH procedure that people pay out of pocket for, but if you have out-of-network, you could get reimbursed, at least something for that. But all the blood testing that we do, and we cast a wide net, is all covered by insurance.
Okay, and I just had some recently, so I could maybe make an appointment and share that with you.
Absolutely.
And then in addition to the thing that you said about kelp, then I eat quite a bit of sushi. So I'm just wondering, does that mean that sushi with the kelp is not good?
The problem
I have Hashimoto's, so also.
The problem is mercury.
Yeah, I'm not eating tuna.
Well, sushi too. You could get elevated mercury.
Mm-hmm.
So be careful with that. I would test for mercury levels.
Yeah, I had an issue with it before, and I had to have what is it called? That
Chelation.
Yes, chelation therapy, which took care of it. So
okay. All right. That's good.
Great. So I will call the office and
Oh, okay.
thank you.
Very welcome.
So we have so many questions and unfortunately limited time. So I had written down our email and our website in the chat. We'd love to get everyone's questions. If we didn't get to your question, feel free to email us at info@thehealthychoice.net. And I'll put down Dr. Kellman's information down there as well. We can get back to you guys.
Yeah, Corinne, post Dr. Kellman's email and contact information in the chat as well, so everybody has that.
Yep.
Absolutely. And we do offer a free 10-minute conversation, phone call. You could also email us with questions, and we'll definitely get back to you.
And this will also be posted on our YouTube channel off our website. So you guys who want to review it and revisit it, you'll be able to do that, and you'll have all of Dr. Kellman's contact information on there. I think we could keep on doing this all night long with all
Yeah, definitely.
here. But I know Dr. Kellman's on vacation, and so we don't want to take more of his time than we have
Oh,
to.
it's a pleasure. You really, thank you, Phil, very much. And Corinne, thank you.
Absolutely. Thank you.
So anybody who has any additional questions, please don't hesitate to reach out to us. Thank you for joining us tonight, and a big thanks to Dr. Kellman. Like I said, we've worked together for a very long time, and he never ceases to amaze me, and the way he comes up with his thyroid preparations. A lot of it is not just the testing, it's him. It's his experience, his ability to really personalize and come up with the proper dose for his patients. Is really
nice.
come on, I gotta be a little schmaltzy here, you know?
Yeah.
He's all good. So that's our experience with Dr. Kellman.
Thank you.
Dr. Kellman, anything you want to say before, any other questions you want to address? It's up to you.
Yeah.
We'll stay as long as you want to stay.
No, I don't mind taking more questions. Why don't we take a few more?
Two more.
Okay.
Two more is fine.
Okay. Is the TRH test useful if you have already diagnosed hypo and on thyroid hormone, yet still have cold hands, feet, and other issues?
Oh, absolutely. It's a more precise test. Absolutely. It's not only good to diagnose people who have not been diagnosed, but it also is very important to get on the right dose. And with the TRH test, it gives us much more accuracy to determine if it's the right dose. So the answer is yes.
Great. All right, next question.
Make it a good one, Corinne.
Okay, let me go through them then.
To your sons, period. I would like you to stop influencing him to go forward with this, especially.
I'm not sure if she meant that was for us. Okay. My TPO is 85. Should I be concerned?
You want to get it normal, and you can get it normal. LDN will help get it normal. Many other compounds will get it. No, you want to normalize it to that it's in the reference range.
Okay. Are you taking new patients? How
Of
about
course.
that one?
There you go. We can end on that one.
Absolutely. Good way to end. The answer is yes.
Great.
And you'll even get a free 10-minute consultation.
That's right. Thanks again, Phil. Thanks, Corinne. This is great. I really appreciate it.
Hey, thanks, Dr. Kellman. You were excellent as always. We appreciate your time, and I know you're away, but thanks for everything. We'll see you when you get back.
You got it. Thank you, everyone.
All
Thank
right.
you. Have a
Take
good
care.
night.
You too all.